right, we will go ahead and get started. I wanted to welcome you to this afternoon's webinar presented by the Johns Hopkins Medicine Office of Diversity, Inclusion, and Health Equity, where we'll be reviewing guidelines for facilitating listening sessions and racial dialogues in your department. Just a couple of things before we get started is that we will ask that you record any questions that you would like us to address in the question and answer area as opposed to the chat box. And then I'm going to go ahead and get started. Today we'll be accompanied by Ms. Cherie Wilson from my office, who's our program manager for diversity and inclusion training. And then also Dr. Peter Hill, who's our Vice President for Medical Affairs for the health system in Johns Hopkins Hospital, who's going to share how he operationalized this experience, as well as Ms. Suzanne Sawyer, who is our Senior Vice President of Marketing and Communications, and she will also share how she implemented this in her department. So, one of the things I think that's really important to recognize as you're considering whether or not to have a listening session in your department is really to find out from your employees and your Black and African American employees in particular, if they feel that a listening session will be beneficial. And part of this is because we have to recognize that the unrest and the protests that followed the killing of George Floyd is really on the backdrop of the COVID-19 pandemic that, up a couple of weeks ago had killed at least 25,000 Black and African Americans in the US. And so for many of your Black employees, faculty, trainees, and colleagues, most of them know someone who either in their own family or extended family who've died from COVID. So really the other issues that have happened have really almost been like a Band-Aid that was ripped off. And so I think it's important for you to understand that as you think about how to have these dialogues and whether a listening session would actually be beneficial to those in your department. So I want to start out just by sharing 3 common missteps that it's important to avoid. And so one is that you want to avoid keeping silent. So, just even a simple gesture like reaching out to ask your employees, just checking on you to see if you're okay. I know this has been a difficult time. Or, just want you to know that I'm concerned, and not so much to say that you understand, but just letting them know that you recognize this has been difficult will really go a long way. A lot of people just want to know that you as their manager, director, supervisor, are concerned about them. Some people, when you ask that question, they will walk through the open door and perhaps share how they're feeling, but there are other people who may not share how they're feeling. But again, just that show of support is helpful. I just want to emphasize that silence right now is deafening. So not saying anything at all and just going about work as usual is sending the message that, we actually don't think that this is really either relevant or important. And that's not what most of us believe. So just want to acknowledge the importance of not staying silent. The other is to avoid being defensive. And so as people begin to share their personal experiences that they've had with interpersonal or structural racism, for example, they aren't saying that you are a racist. They're saying this is my experience that I have had. And so it's important to just listen to that, even if it's uncomfortable, and avoid becoming defensive. And then the third thing to avoid is overgeneralizing. And so, while there is discrimination in multiple spheres, and racism is just one form, in fact, the issue right now is about the Black community. And so it's really important not to, generalize that to other things. And, just to give you an example, if we're at the American Diabetes Association walk to raise money for diabetes, nobody at that walk is saying, well, heart disease matters too, or prostate cancer matters too. Of course, we know that all of those things matter, but the focus of that particular day is on diabetes as an epidemic, for example. So just, that's an example. And similarly, when people will say, well, all lives matter or white lives matter too, as a response to the Black Lives Matter hashtag. But, in fact, in our Constitution, there was a period where slaves were considered 3/5 of a human being. And then at the turn of the last century, there was a real focus on eugenics theory, sort of coming up with sort of scientific theory to indicate why or how people who were Black and of other races were biologically inferior. So we know today that that is actually not true and has no scientific basis. But again, these are things that have lingered from our past that create some of the current biases that we see. So in fact, that's why it's important not to generalize. So what are some steps then to take meaningful action? And that's really where we want to focus the rest of the dialogue this afternoon. So it's important to acknowledge, it's important to affirm, and it's also important to act. So in the acknowledging category, it's really important to do research to fully understand the events that have occurred recently, as well as those in the past from reliable resources. And we've provided many resources on the landing page of our website. We also, it's important to give your Black employees space to be angry, to be afraid, to be disenchanted, or even disengaged slightly from work. And again, because people are still are grieving and trying to process events that are continuing to unfold. And remember, this is all happening on the backdrop of, a COVID pandemic that has really devastated the community already. It's important to seek support from human resources, from our office, read books and articles that we've recommended. It's important not to ask your Black employees, faculty, or trainees to educate you about the events that happen. So, statements like, well, I just don't understand why everyone is so upset. Can you help me understand? Number one, it really, for them, puts them in a scenario of having to relive or re-articulate things that perhaps are very traumatic for them. And so we really want to avoid that. And then similarly, we want to avoid asking our Black leaders and employees to be the source of comfort or advocacy around these issues of social justice. In fact, what we really need is for everybody to be advocating together, because many of our Black leaders and employees are, in fact, they're just trying to process this information themselves. And so we want to be sensitive to that. So what are 10 steps to non-optical allyship? So it's important, non-optical allyship means really active allyship, where it's not just checking off a box, but really actively engaging and supporting your colleagues. So we already talked about one that's important, that's checking on your Black friends, partners, loved ones, and colleagues. It's really important to be prepared to do the work. So that means reading up on anti-racist works, really willing to sit in your discomfort as you learn and grow. As we've talked about, avoiding sharing content that's traumatic. So, reposting videos, for example, of George Floyd's death, all of those things are very traumatic. So we should avoid sharing and reposting content like that. We can donate to funds that support initiatives that support the Black community right now. And I think very similarly, stop supporting organizations that promote hate. Right now we have a lot of choices to think about, where are we going to spend our money to support our economy? And we certainly want to be donating to supportive organizations currently. It's also important not to center the narrative around yourself. And again, that's this construct of overgeneralizing. So, saying that, I know what you mean because, when the police pull me over, I also, get sweaty palms and feel nervous, but recognize that, if you're a white person in America and you get pulled over by the police, you may be worried about getting arrested or worried about getting a ticket. Whereas if you're a Black person getting pulled over by the police, you're worried about losing your life. And in fact, getting a ticket or getting arrested might be the least of the concerns. And so that's, again, not centering the narrative around yourself and not overgeneralizing. I think very importantly, it's important to keep supporting after the outrage. And so after George Floyd's murder, there were a lot of protests, 19 or 20 days of continuous protests around the country. Some of those protests are settling down now, but recognize that the hurt, the pain, and the issues of structural racism are still there. So it's important to keep supporting the community and your colleagues even after that outrage has subsided. And then finally, you want to start your own long-term strategy. What is your strategy to to moving toward becoming more anti-racist and becoming a stronger ally. So I really like this diagram that really talks about that. And, it really starts out over here in the fear zone, which is where many of us start. So that's where you deny that racism is a problem. You avoid asking hard questions. You strive to stay in your comfort zone. And then you also prefer to talk with others that look and think like you do. And so when you're in this fear zone, this is when it's easy to make statements like, well, I just don't see color because I'm colorblind. And, the reality is if you don't see that I'm a Black woman, then we probably need to have you have an appointment with the Wilmer Eye Institute, because in fact, I am a Black woman. It's okay for me to be a Black woman and for you to say that, like it's okay for you to be a person who's maybe a white man or a white woman. So just, that can be a manifestation of still being here in the fear zone. When you get into the learning zone, that's when you begin to recognize racism is not just a past problem, but a present and a current problem. You seek out questions that make you uncomfortable. You understand that you have your own privilege in being able to ignore racism. You begin to educate yourself about race and structural racism. And then you're also vulnerable to your own biases and knowledge gaps and begin to recognize them. And you begin to listen to others who think and look differently than you do. And then out here in the growth zone, that's when you begin to realize that you identify with how you've unknowingly benefited by racism, that you promote and advocate for policies and leaders who are anti-racist. You're willing to sit in your own discomfort, and then you speak out when you see racism in action. So many of us may have been in a scenario where someone, cracks a joke that makes everybody uncomfortable. People know it's inappropriate, but no one says anything. But then you become the person that speaks up and says, ouch, that was inappropriate. You begin to educate your peers about how racism harms our profession. In our case, that's healthcare. And then you don't let your mistakes deter you from being better. So, this is a growth process. And so we'll occasionally have a misstep, but, you just say mea culpa and you learn from that and don't let it send you back here to the fear zone. You also yield positions of power to those who might otherwise be marginalized. And so, as I've listened to the stories of a lot of our Black and other underrepresented faculty and administrators who are very talented, who've left here for other organizations, we frequently hear that they didn't see opportunities for advancement here. And so this is when you're becoming anti-racist in the growth zone, that you look for opportunities to promote those individuals, you sponsor them, and put them into positions of influence. And then you begin to surround yourself intentionally with others who look and think differently than you. And I will say that, having lived in Baltimore and been at Johns Hopkins for the last 26 years, that this is one of the most diverse cities and environments in which to work. So if it's any place that we could move into a growth zone, I think it's sort of here in Baltimore and within Johns Hopkins Medicine. So what are some specific guidance for your listening sessions and town halls? Right now, we really want to focus on the listening component to really hear what the employees' concerns are, because we want to be able to use that information to inform our strategic action plan, as well as a future series of town hall listening sessions that we want to have at the end of the summer. These should be voluntary and not mandatory. And again, that's because there are some of your staff that are still grieving and may not be wanting to talk about this. It's important to follow ground rules regarding respect and civility to create a safe space. Because we're having to do a lot of this by Zoom right now, I would recommend not recording. Smaller groups are better than larger groups. So that means for those of you with large departments that this may require multiple sessions. So in terms of thinking about our preliminary racial dialogue strategy, this is the third of our 5 Zoom sessions, sort of giving these best practices for listening sessions for leaders and managers. We've also video recorded this presentation, and hopefully by the end of the week, that'll be posted on our website. In addition, we are evaluating a framework called Restorative Justice Dialogues and Conferencing, which is a way to identify harms that have occurred in an environment and then bring the parties together to figure out how to repair that harm and rebuild trust. And so what we find is that if there has been a racially insensitive comment or series of actions. And even if our human resources evaluates it or organizational equity evaluates it, the people still have to work together, and that's actually never been addressed, so there's no closure. And so this is a mechanism through which we can actually bring closure. And this has been applied to colleges and universities, and the American Association of Medical Colleges is actually applying it to the academic medical setting now. So this is a framework that we'd like to train individuals on across our system to be able to help facilitate that component of discussion. We will also be requiring unconscious bias training for all of our managerial and above staff, as well as our credentialed medical staff, our faculty, and our trainees and students for FY21, and there'll be more information coming out about that. I will say that unconscious bias training is foundational just to begin to open your eyes to your various biases. You can have biases in many arenas, and so race is just one, but that is sort of is a way to sort of begin to open your eyes. So that'll be really helpful in preparing us as an organization to then begin to develop and receive an anti-racism curriculum, which we'll be developing with colleagues in the School of Medicine and the History of Medicine department. And one thing I will point out is that we're talking about an anti-racism curriculum initially, but there are all kinds of isms, as we know, and biases. So we really want to expand this to be a multicultural sensitivity curriculum, and this will be the first component of that. So in terms of initial reading, Not in My Neighborhood is an excellent book I'd recommend reading if you haven't. It actually talks about structural racism that happened in the city of Baltimore in the early 1900s, where there was redlining and predatory lending practices in certain neighborhoods in the city. So as a city was converted from a street in a city was converted to a street that was all white to one that was becoming mostly Black, then they would actually brokers would give these very high interest loans where there was a high likelihood of default. And then they would then say that neighborhood is redlined because those are neighborhoods where people should not be lending because it's highly risky lending. Interestingly, those were neighborhoods that were usually Black or immigrant communities. There would be neighborhoods lined in yellow that were intermediary, so neighborhoods in transition, and then green neighborhoods were typically all white and considered to be safe. But the challenge here is once a neighborhood was redlined, then public works stopped going to that neighborhood as often, and so it was not uncommon that there would be less trash pickup, there would be less investment in the schools, and less economic development in those neighborhoods, and so there'd be fewer shops and stores, and so those neighborhoods would decline. And so that's sort of how many of those neighborhoods in Baltimore City today are still like they are because of the residual of what happened over 100 years ago. So this is a really compelling read. The other one is called White Fragility, which is by Robin DiAngelo, who is a white racial strategist and dialogue mediator. And she really writes this book from the vantage point of a white person. And it's very compelling and talks about how you can understand and grow to becoming anti-racist without becoming defensive. And so really discusses that in her book. So I just want to share this in terms of how we'll be thinking about the levels of racism as we develop our institutional policy, as we review our current policies, and as we move forward, is really the 4 dimensions of racism. And Cherie had shared this when last month when we started thinking about this, and then Jen Nichols sent me this schematic, which I think illustrates it very well. So there's institutional racism, which is where policies and practices reinforce racist standards within a workspace or organization. And then there's structural racism. So that's when multiple institutions collectively uphold racist policies or practices. So that's like the example that I just told you about in Not in My Neighborhood. So redlining was one institutional racist practice, but then now we're also discriminating and giving loans in that area and in investing in schools and in the economic engine. So now we've got three sort of sets of policies that are working against that neighborhood. That's structural. Interpersonal racism is where racist acts and microaggressions are carried out from one person to another. This is probably one of the ones we think about or encounter quite commonly in the workplace. And then there's internalized racism, where there's subtle and overt messages that reinforce negative beliefs and self-hatred in individuals. So I just want to thank you for listening. This is the link to our website, which has a lot of the resources that I mentioned in this presentation. And I am going to stop sharing my screen, and I want to allow Peter Hill and Suzanne Sawyer to share. I'll have Peter unmute himself first, and then we will find Suzanne to have her unmute next. So Peter.
Great, thank you, Shrita, very much. Yeah, as you described, I have hosted 3 listening sessions now for 3 of my departments. One was probably too large. I didn't really appreciate how many people were going to be on that call, but it still went well. The way I approached this is I opened with a thank you that we are, and then I wanted to have an opportunity to have people in our department share and listen to each other, to reflect on their feelings and experiences as a result of the events since George Floyd and other similar incidents, and the transformation that we hope that our country might be experiencing. I opened that I wanted this to be about them and a time for them and not me, but that I was going to start with a few thoughts to get the session started. I said that this was a safe space, that while I may take some notes about themes, I'm not writing anybody's name down, and that this was something that we hope we could continue going into the future. And I opened with an acknowledgement, something that had occurred to me over these weeks, that I had shared with others, that as a white male, I belong to a class of individuals who had been wholly responsible for the past 401 years of integrating racist policies and structures into our society. And that was a very powerful thing for me to think about and internalize, and that I had been, the benefactor of white privilege as a result, in ways that I can probably identify, but in millions of ways that I can't. And I also acknowledge that I could never, and likely will never be able to fully understand the lived experiences of somebody of color in our country and in our society. And I wanted to open with that acknowledgement. I then also read a few sentences from a memo that my chairman, Gabe Kellen, sent out to our department, some of which I thought was very powerful. And then I simply closed by saying that that talking about this topic is in this forum is new for me as well. I don't have the answers, but that I do know that being silent, particularly someone like me being silent, is being complicit, and that has to end. And so then I stopped, and I then opened up for anybody who would be interested in sharing and starting a discussion. And there, in all 3 instances, there was a period of silence where I didn't know what was going to happen. But then in each of the instances, somebody then opened up the discussion and started sharing. Each one was slightly different in flavor and in tenor and in tone. And I, to your point, I tried very hard not to make any comments about what people say, not to make any justifications, right? Not to make any explanations. I listened, I thanked them. There were very sort of little direct questions. I felt it was important that nobody needed me to validate anybody's feelings, right? It was about just being there and creating a forum to be able to express what people wanted to express.
So thank you, Peter. I wanted him to share because I thought that was really powerful and compelling way to open up a discussion. And so, on previous of our webinars, people had asked, well, how did you open up? How would you recommend opening up a discussion like that? And I think, being very transparent and real as a leader is probably the best way to do that. And so thank you, Peter, for sharing that and having the courage to do that. And I have Suzanne Sawyer, who's our Senior Vice President of Marketing and Communications, discuss how she has operationalized these principles in a listening sessions that she's done in her department. So thank you for joining us, Suzanne.
Thank you. Thank you very much for having me today, and thanks so much for your comments. I think they're really important, and it's really something that I'm very glad to do, to share with you a little bit about the listening sessions that my team has participated in marketing and communications. I have a staff of about a little over 150 people all across the health system and Johns Hopkins Medicine. And I just remember coming in on Monday, June the 1st, really a full week after George Floyd's killing, and really feeling the environment, the mood, the angst, I guess you might say, of my colleagues. And like most Monday mornings, I started off with a senior staff meeting, and I realized right then that it would be important to just realize this was a day like no other day I had experienced in my work life. People were somber. People were just, I would say, just quiet. And so I realized I would take the time to open it up for conversation. I thought, I'm going to set aside the work of the day and really listen to what was on people's minds in the aftermath of George Floyd's killing, protests, riots, and lots of angst, anxiety, and high emotion. And I asked really just a couple of questions, just open-ended. How are you feeling? How are you doing? And at first there was some silence, and then people started, really sharing their thoughts and their incredible frustration, anger, just sort of intense emotion. And we spent actually about an hour having a conversation about it, and wanting very much to be able to take the time with other people on our staff to have similar kinds of conversations. And in fact, over the course of the next, I would say, 10 days, I facilitated 9 sessions. And as Dr. Golden said, small groups are really, really best in many ways. But we also had conversations by large groups. And those conversations were very powerful, including a full staff meeting that I had on Thursday of that week. And the more we listened, the more we heard. And again, like I said, at first it was very sort of awkward, heavy silence. And I just let the silence hang there. And then people started sharing their stories, their personal stories. Some were very, very personal. There was one man on our staff who spoke about being stopped by the police 3 times in his life, and pushed down to the ground and had a gun held to his head by police, and then taken to jail for crimes that he didn't commit. And he had actually suppressed these memories for decades. And the way his story came out was overwhelming, I think, both to him, but also to his colleagues, all of us, because just the experience of his recounting those situations, all 3 of them, and other smaller ones, so to speak, over the years was just really overwhelming. By people, it was overwhelming to all of us who have known him and his colleagues who have known him much longer than I, for over a decade. And so, as I say, the more we listened, the more we heard many, many conversations, many, many situations. What we tried to do was create really a safe space for difficult conversations. And as I said, we heard things that were very heartbreaking and shocking and deeply personal and really very emotional. And people said it was really the first time that they had ever had a dialogue like this. And again, after knowing people, working next to each other, knowing each other's families and so many things about one another, they had never had this kind of time or interaction, I guess you might say. So after those, I would say the first just over a week, we took a few days to really try to digest on what we heard. And I held another, I guess you might say, a town hall meeting. Again, of course, it was optional for people to attend, but we had about 140 people join us for that session. And one woman, a white woman, spoke about how she had done some very deep soul searching over the days that had preceded that meeting. And she talked about recognizing, really for the first time, her white privilege and recognizing what it is and really feeling very motivated to be and to become more aware of the issues that our colleagues are facing in their lives, at work, at home, in their communities. And so it was very moving to hear her speak about these things, I think, for all of us. As I say, other stories came forward as well. And the conversation that we had was really around everything that we had heard in our prior staff meeting. We really digested and had conversation over those several days to really say, what should we do? And Dr. Golden actually has been a great colleague, because you have given me great counsel along the way. And what you said to me was, be sure to listen. Listen before you act, right? Be sure to listen. And And as I say, we did for about a week and a half, but our team was raring to go to really try to say, okay, we've got to do something. We've got to take some action. And our first steps have been small baby steps, but I'll share with you what some of them were. We wanted to really demonstrate a commitment as a team and as individuals to have true dialogue and then hopefully a plan to address some of these issues. And I will admit, personally, myself, I felt unprepared for knowing how to host or manage or bring together people for this conversation. And the reality was the most important thing was to just open it up and the conversation happened. But what we did decide to do was to create some work groups around 3 different goals. And the first, and I think frankly the most important for us and our team, at least in this moment, is to focus on the well-being of our staff. And then there are a couple of other goals as well. And so people have volunteered to be in work groups to really look at each of these goals and essentially develop a plan of sorts about how, in this case, to focus on staff well-being. We do have an employee engagement and diversity council in our group, in our staff, and that's always been a very, very active group. And so one of the things that we're doing is we're going to have essentially a book club and a film club kind of idea of picking a book for the whole team, whoever wants to participate, to read and then reflect on issues around race and racism. We also are going to be doing the same thing with reviewing a film and having a discussion group as a team. We also decided to do an employee survey, and we sent that out at the end of that second week, so around the middle of June. And it was really a social climate survey of our staff. And within an hour, the first hour that the survey was sent out to our team, about 25% of our employees responded to that survey. And ultimately, we had about nearly an 80% response rate overall. And I actually just received the results to this survey just actually last night. And the feedback has been really overwhelming. I'll just maybe share a little bit of feedback just for you to have a little bit of sense of what it was like. We asked a question for everyone: has your manager facilitated open discussions around the recent social climate events in the country? In our case, we had 82% say yes and 17% say no. We had a question: please rate your level of agreement or disagreement with the following statements, again related to the events that had transpired. And the question was, have you had any conversations, again, with your manager, and how strongly do you agree or disagree? So one question was the discussion meaningful? And there was a 5-point scale. And was the discussion helpful? Was the discussion sincere? The discussion created learning opportunities. And so this was so very helpful to see what kind of feedback we received. On the one hand, the question about was the discussion sincere, agree or strongly agree was 91%. But on the other hand, there were other bits of feedback around, was the discussion helpful? People want more action, not just conversation. And we will move toward that direction, and that's where we're headed. Would you like your manager to facilitate open discussion about the recent events in the country? Would you like your manager truly to actually facilitate? And it was sort of 50-50. Some said yes, about half said yes, about half said no. And then I thought, and I'll end with this, we invited verbatim feedback, right? So for people to be able to type a response to a number of key questions. One was, what is your biggest concern, if any, regarding diversity and inclusion within marketing and communications? And another question was, same question, except it related specifically to Johns Hopkins medicine. And then there was a question, have you experienced any form of racism at work? Yes or no? Was it addressed properly or adequately? Yes or no? And then finally, what's the single thing that Johns Hopkins medicine can do to help with recent events? And we had 19 pages of, I would say, 12-point type of responses to those questions. The feedback was overwhelming and extremely helpful. And so now we're in the process of sort of digesting it, and we're going to be sharing the high-level results tomorrow. And then we're going to open it up so everybody can see results and key findings and see where we go from here. But that survey will really help inform where we go in terms of plans and action and how we work together. So thanks for the opportunity to share just some of our experiences from the last several weeks.
Thank you, Suzanne. That was very excellent and very helpful for people to hear, how you actually operationalize these sessions. So we will now open it up for questions.
Great. Thank you, Dr. Golden. So the first question we have is from Lori Payne, who asks, can you recommend resources for employees for whom these dialogues may be triggering of past trauma?
So that's an important question. I think that's one of the reasons to not have it be mandatory, in case there's people that might want to choose to distance themselves if they realize some things may be re-triggering. If they're in a session and realize like suddenly the discussion is triggering, one of the places to start, with resources would be, through like my support, and then there could be additional referral from there if needed. But again, part of the reason to make it, not be mandatory is so that for some people where this would be triggering, they could avoid it if they feel like it's going to be a problem for them.
Great. Thank you, Dr. Golden. This is actually a question for Suzanne. The question is from Deborah Williams. How did you start the conversation and what did you say?
Well, as I say, there were several different conversations with different groups, but they all pretty much started the same way. It was really saying that, as we look around across our country and our community and our team, we are in a time like no other. And I just wanted to take a pause to ask, there's two questions that I mentioned. How are you feeling? And how are you doing? And I really didn't try to provide much more context than that. I think everybody knew what it was about, and the responses definitely showed that. And then it was just it was listening, and then there was good conversation between and among colleagues. And frankly, a lot of really personal support. You know, people saying, I'm so sorry to hear that you went through this, or I've never heard of anything like that happening before. I can't imagine how that affected you and your family. So that's how we started it.
Great. Thank you, Suzanne. And the one question that's been coming in from multiple people, and this is again for Suzanne, is about the survey that you mentioned. So would you be able to share the survey instruments? Obviously scrubbed without responses, but just the questions, because I think a lot of people are very much interested in doing something similar.
Absolutely. You bet. Maybe it's best to go through, would it be something you'd like to share through your office, or I can take names, whatever you think is best?
Yeah, I think we could we might be able to share through our office. We could maybe put it in a link on our website.
Right.
Sure.
Okay with you? That's
or whatever's
probably.
best.
Yes, maybe we could share it. And I wanted to just remind everyone that we are recording the webinar. So there will be a webinar recording as well as the slides. So maybe it could be posted as a resource along with those. I'm thinking. So great. Thank you, Suzanne, for that. And let's see. Oh, so a question from Angela Mackey, and this is again for you, Suzanne. When you were sharing who participated in this survey, the question was, were those questions from Hopkins downtown staff or enterprise-wide? My understanding is that it came from your division, marketing and communication.
Yes, that's right.
Yes. Okay. So
but it was marketing and communications across the enterprise. So all children's in Sibley and suburban, Howard County, Bayview, JHH, as well as other parts of our business as well.
Great. Thank you very much. Let's see. Okay. So the question is that, so we've had people reach out to our office asking us to facilitate these listening sessions. And I'm going to pass this one to you, Dr. Golden. But our goal was that by holding these 5 different trainings or guidelines, our goal is that we want the departments to feel empowered to be able to hold these listening sessions. So I was wondering if you could address that, Dr. Golden.
Yes, no. So I think, the idea is that, interestingly enough, I think it's important for your employees to hear from you as their leader, just so that they know that you care about the issues and that you're concerned. I think a lot of people, as I mentioned earlier on, are concerned about saying the wrong thing. But in fact, since it's mainly about listening, it's hard to say the wrong thing when you're actively listening. And I think it's really important for, again, your team to see you as their leader are concerned about this. And that's even more impactful than, say, having someone from our office do that. So that's why we want to give you the guidelines to be able to do this effectively.
Great, thank you. And let's see. So yes, so we have a question from Dana Daughtry. Would you recommend sharing the content of this session as a means to educate employees? Voluntary participation for those interested.
So I think there is definitely content in this session that would be very helpful for educating employees. So, for example, the slides around the allyship, because I think all of us can learn to be better allies. The slides around like the levels of racism, for example, and helping people to understand what some of those levels are. So I do think that these could be general guidelines, particularly also just how to, how to support employees who are going through this right now. So I think that these slides, and as Cherie mentioned, they will be available on the website, would be a good resource for that.
Great, thank you. So let's see. A question is, were your non-Black employees supportive of the Juneteenth reflection that was shared? I think this might be referring to the email that was sent out enterprise-wide.
So we have not gotten any direct feedback about that specifically. All I will say is that, we wanted to partner with the university on acknowledging Juneteenth. I think the differences between the university and the health system is that we have to keep clinical operations going. And so, what I have recommended to the Diversity Leadership Council at the university is that if we're going to do this in the future, that we do so with enough advanced planning so that people can, have time to request that time off so that they can observe. So, but we didn't receive any negative feedback directly related to Juneteenth from non-Black employees. It was just mainly around, that it was short notice and the timing. And so that's something that, will be addressed in the future.
Great. Thank you, Dr. Golden. Oh, we have a book suggestion from Tamikia Butler, and it is Vernee Meyer's book, What If I Say the Wrong Thing? And this book touches on diversity, cultural differences, and offers an African-American female's perspective on sexism and biases in the workplace. So thank you, Tamikia, for that suggestion. Appreciate that.
Yes, and she has a really excellent TED Talk that's online as well.
Yes, how to overcome biases, walk boldly toward them.
Yes.
Fantastic. We highly recommend it. If you just go out to YouTube and look for Vernee Meyers, it's fantastic. Highly recommend it. And it's also mentioned in our resources. So here's a little plug too. So on our website as well, if you look under the announcements section, we have numerous resources. So 10 ways to be a non-optical ally. There are resources on books, videos, video clips, articles, you name it. And so there are about 5 or 6 different resources there. So I recommend that people check those out. Okay, so here's our next question, Jeanette Nazarian. I am white and also in leadership. I'm looking for all and any help in working on the very real racism and inequities present both where I work and how I live my life, but also in how I support the people with whom I work and also facilitate these dialogues. Do you have recommendations for how to establish safe spaces for these discussions? What ground rules should we have to ensure everyone can participate and feel supported and safe? And also, thank you so much for this webinar. It's already helped me a ton.
All right, great. Well, thank you for those are all excellent questions. So I'm going to try to make sure I answer all of them. And so, so I think that one of the things in terms of how to address the racism that you see in the workplace is we're going to be sort of rolling out a Johns Hopkins Medicine sort of diversity and inclusion strategic action plan. And so part of the reason that we think listening sessions are valuable right now is to be able to hear from employees what they feel some of the major concerns are. We were in the process of nearly finishing our JHM strategic action plan at the end of last fiscal year. And then when the more recent incidents happened, we want to make sure that we've incorporated any additional information that is important to our employees that perhaps maybe isn't in the current draft. I can say that so far, most of the issues that have arisen are in the current draft. And so in terms of being able to address this in your workforce, this will be a part of the larger strategic plan that will then give managers, supervisors, and leaders the tools they need to be able to address that in their own workspaces. The other question was around then how to perpetuate that same spirit of wanting to become anti-racist in your own environment outside of work. And so again, I think the things that we shared around allyship and some of the reading can be very helpful with that and speaking up when you see and hear things. I don't know if any of you ever watched that show, What Would You Do, that comes on Friday nights, I think on ABC, but like if you're out and you see or hear something, using that as an opportunity to educate, if you have like teenager, young adult children that might be a little bit embarrassing to them, like I always educate about portion sizes in restaurants because I'm a diabetes physician and my son slides under the table. But again, we can use all of those opportunities, whether we're inside of work or out to educate. But I think one of the things that our office is really focused on in our executive leadership is we just want to make sure the work environment does not re-traumatize people. Like we may not be able to control everything outside of work, but we want to make sure we're addressing the things inside of our walls. And then in terms of how to have the sessions, I think was that one of the other questions is how to create the safe space. So we are still in a pandemic. So I think all of the listening sessions that have been occurring are have been virtual or via Zoom. Interestingly, we've still been able to get good feedback and participation from people via Zoom. So you can do it that way. As I mentioned earlier, I wouldn't record it so that it's a safe, you know, because if you just don't want there to be any recording so people know it's a safe space. And I would set the ground rules by saying, you know, what's said in this chat stays in this chat, and that, you know, it really needs to be a no judgment zone for people to not have things held, you know, against them afterwards. And I think that, you know, when you have, the other thing is, like, you may have one initial listening session and there may be follow-ups that your team wants to continue to discuss. So, you know, as dialogues continue over time and people discuss issues in real time as they're occurring or evolving, then it'll build those relationships and that trust and make it a little easier. I think, did I answer all components of the question, Cherie?
Yeah. Yes, you did, Dr. Golden. I know that was a lot. Thank you. We also wanted to put in a plug. Thank you, Jennifer Clark, for mentioning this. So Learning and Organizational Development will also be hosting a book club discussion with the book So You Want to Talk About Race by Ijeoma Oluo. So we wanted to put a plug in for that. Thank you, Jennifer.
Yes.
And let's see, there's a lot coming in fast and furious. So one question. Okay, so yes, about the ground rules, we do again have links to resources about ground rules, and those are on our website. So I just wanted to mention that. And let's see. Oh, okay. Yes, this question has come up in all of our sessions. So as we are addressing current events, will the organization go over other affected community groups throughout the year and have similar conversations?
Yes, so that has come up, and so just to be clear, you know, we're the Office of Diversity and Inclusion, you know, for everyone, and so I think that I would hope in my first year, which I just officially came to an anniversary date on July 1st, but in the first year have really tried to be very mindful of all of the current issues that are happening in our country and how they affect our various employee groups, and so we have you know, made statements in support of our immigrant community, our patient population, making it clear where we stand on the public charge, that we're still treating our patients. And, you know, we have actually put together like immigrants' rights. And so a document for our patients. So we've been had a lot of advocacy there during COVID. We have been very strong supporters of advocating for mobile testing and other resources to support the Latino community during the pandemic. You know, we have acknowledged Asian American Heritage Month. Most recently during Pride Month, we had an LGBTQ health disparities a symposium to raise those issues, and are in the process of launching an LGBTQ employee resource group. This is the 30th anniversary of the Americans with Disabilities Act, so we have been collaborating with Bonnie Sweenor and others here to address those issues. And so, you know, our office and me as a Chief Diversity Officer have really strive to be the Chief Diversity Officer for all of our populations. I will say right now, it's been very important for me, though, to be sure that I'm a Chief Diversity Officer for the Black community as well, because the current pain is about that community, and it doesn't in any way diminish what's occurred in other communities. But, you know, there have been a series of traumatic events in a short time between the COVID disparities and the you know, the police brutality that have just been cumulative. And so, so right now that is our focus, but, you know, our strategic plan is completely inclusive of all groups.
Great, thank you, Dr. Golden. This next question, Meredith Hurston was asking, any thoughts on whether it's more effective to have a white or Black facilitator for these discussions? And would you mind if I took a crack at this one first?
Yeah, I'll let Cherie take a crack.
Yes, because this one's been coming up in every session. So thanks, Meredith, for asking this. So what we've heard a lot is people really want to rely upon their Black employees to lead these discussions, and we're really discouraging that. Racism is a problem that has been the structure and foundation of our society for the past 401 years, and we really need our white colleagues and counterparts to step up and lead these conversations. not get defensive. You're going to hear things that you might not be familiar with that you weren't aware of. So basically, these are meant to be listening sessions, not I'm going to solve the problem right then and there and come up with solutions. And so we think it can be equally as effective to have a white or a black facilitator. But again, you know, for every issue that comes up. So the previous question was asking, are we going to talk about the Asian American community, the LGBTQ community? To be an ally, we don't want to rely upon those who are from the aggrieved group to always have to step up and talk about these issues and be the leaders talking about these issues. And I'll turn that back over to you, Dr. Golden, if you had anything else to add.
Yeah, no, I would agree with that. And, you know, and I also think, because again, people in the affected group are still trying to process and things continue to evolve. I mean, there have been, you know, there was another, you know, murder of a Black man sleeping in a Wendy's parking lot while all of the protests were happening. So all of this is still very fluid. So people are at different places. One thing I will say that if you are a manager or a supervisor, an executive leader who happens to be Black, then you might want to actually, and you're the leader, you might want to maybe co-lead the listening session with one of your white colleagues, just so you have another source of support.
Great. Thank you, Dr. Golden. So this next question is, last name is Metz. So I'm going to say the question is, it's one thing to organize this for a division of 150 or so employees. Do you have any thoughts on what we might do for an entire hospital with tremendous diversity of role and hundreds of leaders to engage the broader team of employees? So our intentions were these listening sessions were not to be a whole hospital-wide listening session at once. These are really meant for smaller settings. I know Suzanne started off with her division with a very large group of about 150. But you can have these as smaller group discussions via Zoom, since that's our new normal. So you can have 15, 20 people. Also to be aware that in Zoom, there are breakout rooms. So you can actually have someone sitting in a breakout room who is scribing or who is taking some notes on common themes that arise. So even if you have a large group, breaking into something that is a smaller chunk that is much more manageable. And I'll turn that one over to you, Dr. Golden, to see if you had anything to add.
Yeah, I would agree. Yesterday, Dr. Peter Hill joined us, who's Vice President of Medical Affairs for the health system. And so he's done 3 listening sessions with 3 of his departments. So instead of doing all the groups that report to him, he's done it by like sort of the departments, which can be smaller groups. And so that's how we would recommend approaching that.
Right. And that's very similar to part of what Daisha Balch is asking. So in a small department, I worry the few Black, Indigenous, and people of color in our group will feel overburdened with participating. Are there any resources for smaller groups to listen and learn without overburdening our small unit?
Yeah, so that is a really good question. We had that one come up as well. And so again, what we do not want to do is put any of our employees on the spot. So if they say to you, look, I really don't want to have a listening session where I'm one of 3 people talking about this, I think you have to respect that. But at the same time, if you want to think about, well, how can I still educate others in our work environment, you know, perhaps doing a book club, you know, or, you know, like a documentary viewing as a way for people to begin to educate themselves would be another way to facilitate some of that.
Great, thank you. Lori Payne had a question, and Lori, I meant to type this, but I actually clicked the wrong button. But yes, we have a ton of resources on our website. The specific point where this can be found, if anyone visits our website, if you go to the middle part of the page and it says announcements from the Office of Diversity, Inclusion, and Health Equity, it's the first item that says racial discussion resources. If you click the down arrow, you'll see all the materials that we've put together. So I just wanted to put that out there. So thank you. And let's see, in the interest of time, I'll take a few more. Let's see. Okay, here's one. Any ideas about how to encourage people to be emotionally vulnerable during meetings? So one thing I want to say before I turn this one over to you, Dr. Golden, is yes, you know, people may be emotionally vulnerable during meetings, but I know Dr. Golden raised the point that we don't want to take the focus away from those who are experiencing these different issues. So I've had some colleagues reach out to our office, and we've heard this individually, is you're having these conversations and people start crying. And they're not the people who are actually in the group that's being aggrieved. And what happens is the attention is not focused on the people who are experiencing these issues, but on consoling those who are so distraught because they're hearing about these issues. And it's like, okay, we recognize you're distraught, but can you imagine living with these issues every day? So that is something we don't want to do. Yes, we want people to be emotionally vulnerable, but we don't want to take away from the people who are processing in that moment. And I'll turn that one over to you, Dr. Wolfen.
Yeah, no, I mean, I would agree. And I think that, if that, because for some people, it's very upsetting to realize that certain things have been happening. And so, I have been in situations. I remember when I was a leader in the Department of Medicine and I first started sharing my own experiences outside of what I call the protection of the dome. I would sort of watch people's reactions when I would say, well, it's not uncommon that in expensive stores I'll get followed around and asked like 5 or 6 times if I need help, when in fact I didn't ask for any. That's actually been happening to me since I was 15. And so it's like because they're concerned I might be shoplifting. And that can be very upsetting for someone maybe who's never even considered that perspective to hear. But then, if it's sort of my ally that sort of starts to cry, then if you're going to console that person, then console me as well. Right. And so I think we just want to have like balance in that. And some of that comes out in the White Fragility book, an interesting way to handle that kind of thing.
Thank you. Thank you, Dr. Golden. So we have 1 minute left. So I think we'll turn to closing remarks and statements. So I'll turn that over to you.
All right. So first of all, thank you all for your participation. We get like so many excellent questions. I feel like we could like spend the whole afternoon, but recognize that everybody has to go back to doing their regular work or managing COVID or whatever, all of the various things that we're doing. But, I really thank you for thinking this was important enough to spend an hour of your time with us. And as mentioned, we have the resources on our website, and you can reach us through our email address also, which is diversity@jhmi.edu. And I want to thank Suzanne Sawyer for joining us, and thank Cherie for moderating the questions, and Tamla Knox for getting everything set up. So thank you very much.
Thank you, everyone.